Hi, my name is Julie Talento, and today I will be discussing the SI joint distraction test. In this presentation, I will first be discussing what the SI joint distraction test is, the purpose of performing an SI joint distraction test, and the importance of testing for SI joint dysfunction in patients who enter the clinic with back pain. I will then provide general definitions for commonly used statistics, followed by 3 research articles. Next, I will discuss possible future research, provide my overall opinion of the SI joint distraction test, show 5 multiple choice questions, my references, and then show a video demonstration of how to properly perform an SI joint distraction. As you can see from the pictures at the top of the slide, the sacroiliac joint is formed between the sacrum and the ilium. The left shows a posterior view and the right shows an anterior view. The SI joint distraction test is a pain provocation test, and it is one of 6 Laslett tests that is used for the SI joint. To perform this test, you apply a posterior lateral force to the ASIS in order to stress the anterior sacroiliac ligaments. A positive sign is if familiar symptoms are reproduced during the test, and a negative sign is no reproduction of symptoms. In the clinic, it is important to check for SI joint dysfunction, specifically in patients with low back pain, because approximately 13% of patients with lumbar spine and buttock pain have SI joint dysfunction. In this slide, you see definition for commonly used statistics, but to keep it simple, I'll give you a brief overview. Specificity is the ability to rule out. It is the proportion of patients without the condition who have negative tests. Sensitivity is the ability to rule in. It is the proportion of patients with the condition who have positive tests. Inter-rater reliability is how similar a measurement of the same test is when performed by more than one physical therapist. Positive likelihood ratio is how much more likely it is that a person who tests positive has the condition compared to one who tests negative. Negative likelihood ratio is how much less likely a patient who tests negative for a condition compared to one who tests positive. PPV, or positive predictive value, is the number of patients with a positive test who have the condition, and NPV, or negative predictive value, is the number of patients with a negative test who do not have the condition. Article 1. Diagnosis of sacroiliac joint pain, validity of individual provocation tests, and composites of tests. As you can see when looking at the distraction test in the chart, it has the highest specificity at 0.81, or 81%. Since this number is closer to 1, we know that it has a moderate to good amount of specificity. Therefore, it's likely able to rule out individuals who do not have SI joint dysfunction. However, when looking at the specificity, we see that it is only 0.6 or 60%, which is higher than the middle ground of 50%, but is still on a lower end. Therefore, it is not as likely to be able to rule in an individual with SI joint pain. When looking at the positive likelihood ratio, we see that it is 3.2. That this value is above 1 means that it's more likely that it is a probability, not chance. Since it is 3.2, it is 3.2 times more likely. When looking at the negative likelihood ratio, we see that it is 0.49. This is almost halfway between 0 and 1. 0 being random guess and 1 being more than random. Article 2. Specificity, sensitivity, and predictive values of clinical tests of the sacroiliac joint, a systematic review of the literature. As you can see here, it shows Laslett's 6 tests. When looking at distraction, once again, you see that it has extremely high specificity and higher than the rest of the 5 tests. However, once again, its sensitivity is lower than its specificity. This shows us that once again it is more likely to rule out an individual than to rule in an individual. When looking at Article 3, the value of sacroiliac pain, provocation tests, and early active sacroiliitis, we see that the distraction specificity once again is high at 0.81. Therefore, it's more likely to rule out, but sensitivity is 0.23, therefore it is not very sensitive and very unlikely to be able to rule in. We also see a K value of 0.50, meaning that it has fair agreement between different PTs. Therefore, there is a chance that different physical therapists would have different values. When looking into further research, I found an article of distraction of the posterior superior iliac spine and the diagnosis of sacroiliac joint arthropathy. And in this we see that its sensitivity and specificity are both extremely high, sensitivity being 100% and specificity being 89%. When looking at this compared to the 6 Laslett tests that are commonly used in practice for the SI joint, we see that not only is the sensitivity, but also the specificity is much higher. Seeing these results can intrigue a therapist or a future therapist, seeing how usually specificity or sensitivity is high and the other one is lower. However, in this case, they're both relatively high, which encourages future research to determine if this is a possible test that could be added to rule in and rule out SI joint dysfunction. My overall opinion about the SI joint distraction test when doing research is that this is a good test. I find that its specificity being in the 80s for 3 different articles for tests is very helpful and beneficial because you're able to rule out someone. So even though its sensitivity may not be as strong as some of the other SI tests, its ability to say, no, you do not have this, is much higher. In addition, when looking at the articles, I found that this was one of the top 3 for Laslett's tests, which is also important to know in the clinic. So when you are performing these tests, it is better to perform distraction, compression, and thigh thrust over the remaining 3 because those are the most valid. In addition, this test is also quick and easy to perform. However, I also learned that it is best when used in combinations with others, but this is definitely one test I personally would use in the clinic if I wanted to rule out SI joint dysfunction. Here are my 5 multiple choice, my references. So for my video, as you can see, the patient is lying supine. First, you want to find the patient's ASIS bilaterally. Use the palm of your hand to go over the ASIS and perform pressure down. You can also cross your arms and apply the same pressure, keeping your palms over the ASIS.